Hello friends, let us try to understand in this video what is the true potential of non-surgical periodontal therapy. Should we use it only to control tissue inflammation and reduce the pocket depth, or we can also make use of its complete potential and also regenerate some bone? Traditionally, the main goal of non-surgical periodontal therapy has been to remove the bacterial biofilm and thereby reduce the tissue inflammation and thus achieve reduction in bleeding from the gingiva and also reduce the probing pocket depth and also gain some clinical attachment. And when it comes to surgical periodontal therapy such as regenerative therapy in infrabony defects, non-surgical periodontal therapy has traditionally been only a preparatory step. And this became evident in one of the systematic reviews published in 2015 where they included almost 300 studies and no included paper reported any clinical or radiographic data before and after non-surgical periodontal therapy prior to periodontal surgery, which means none of these studies considered non-surgical periodontal therapy as an important step towards bone regeneration. And in most of these studies included in the systematic review, the reassessment time after non-surgical periodontal therapy was anywhere between 2 weeks to 6 months before the periodontal surgery. If we have to understand the true potential of non-surgical periodontal therapy in relation to osseous regeneration in intrabony defects, we should wait for 6 to 12 months. And the recent report says we should do our reevaluation at specific points, such as 1 month after non-surgical periodontal therapy, we should check improvement in oral hygiene and also reduction in inflammation, which is evident in reduction in bleeding gums. 3 months after non-surgical periodontal therapy, we should reevaluate the soft tissue changes, which is evident in reduction in probing pocket depth and also in clinical attachment gain. And only after 6 to 12 months, clinically and on radiographs, we will be able to identify how much bone gain has happened and how the osseous architecture has changed. And only after we come to know how these intrabony defects have changed, we should be able to plan our regenerative surgery. In short, the latest evidence tells us not to be in a hurry to perform periodontal surgery, especially regenerative surgery, soon after non-surgical periodontal therapy. We should wait for 6 to 12 months and allow time for the bone to heal naturally and reshape the defect.